I'm David Lombardo, and this is WCNY's The Capitol Press Room. And one note to listeners, we're about to have an adult conversation that will touch on sexual behavior, which may not be suitable for all listeners. New York's restrictions on gay men's bathhouses, which stem from an effort to slow the proliferation of the AIDS epidemic 4 decades ago, could be struck down and replaced with new, more modern public health guidelines under legislation introduced this summer. The legalization effort comes in the wake of similar successful campaigns, including in San Francisco and Minneapolis, but opponents argue that a reversal is unnecessary. For more on the conversation, we're joined by the measure's Senate sponsor, Manhattan Democrat Erik Bottcher. Thanks for making the time, Senator.
Thanks so much.
Well, it's my understanding that public baths or spas are legal in New York, but what state law prohibits is the practice of reserving space specifically for sexual activities, with the state health code making the case, at least right now, that these facilities represent a quote-unquote threat to the public health. We can get to the health argument, but from your perspective, what do you see as the public good or benefit from legalizing private rooms and bathhouses for the explicit purpose of sex?
Well, it's pretty simple. It's about making sure that our public health law is in line with today's science. In 1985, the AIDS epidemic was exploding in New York City and around the country, and people were dying. There was a great amount of fear. There was a high rate of death, and the state health department enacted this provision at that time. Things have changed dramatically, and that provision is no longer in line with modern science, with modern treatment. HIV/AIDS is very, very different than it was back then. And cities around the country have changed their policies. New York State hasn't. So this is about bringing our laws in line with science. And that's why we introduced this bill.
And I want to talk more about the science of this and the idea of, say, harm reduction. But just in terms of having the availability of this, why does that make sense? Is there a case to be made for how this is a benefit to the public good for having these types of spaces in spas?
Not a matter of whether or not it's for the public good. It's why should the government be banning these businesses that exist all over the world, in cities around the world, in cities around the country. Red states, Texas, Florida, Louisiana, and most recently Minneapolis repealed their ban, San Francisco. Why should New York be one of the only places that have this ban in place? These saunas were a huge part of gay culture for over a century when they were banned in 1985. Artists like Bette Midler and Barry Manilow got their start performing at the Continental Baths on the Upper West Side. So these were places where people went to relax, socialize. They were a lot more than just places where people engaged in consensual sexual activity. And they continue to be around the world. And a lot of people in the LGBTQ community have increasingly been asking, why is this ban still on the books when it was meant to be an emergency public health measure at the height of the AIDS crisis? Things have changed dramatically. So that's why we introduced this bill to repeal that ban.
Well, the public health case for legalizing these types of private rooms for sex at public bathhouses is this idea of, at least in part, harm reduction, which is the idea that potentially risky behaviors are going to happen, like drug use, for example, so let's provide a safer environment to engage in those behaviors. And the case for harm reduction for drugs, we're talking about needles and drug testing and maybe medical professionals on site. So what does the harm reduction perspective look like when we're talking about this conversation? Does there need to be condoms available, or something like PrEP, or any sort of medical professionals on site offering types of advice, or does that seem unnecessary or unwarranted at this point?
The first thing for folks to know, for those who may not be closely following developments in HIV/AIDS treatment in recent years, is that there's medicine available that can essentially prevent the transmission of HIV. It's called PrEP, and it's a pill that you can take every day. And now it's an injection that you can take twice a year that make it virtually impossible to transmit the virus. It actually brings, even if a person is HIV positive and they take this medication, the virus is virtually undetectable in their bloodstream most of the time. So HIV/AIDS has changed a lot with that fact alone, that it's almost incommunicable for people who are on this treatment. So that's why a big part of our efforts have been to increase the availability of PrEP, to make it universally available and make sure that all communities, especially low-income communities, communities of color, have access to PrEP, and that it's being made available across the board. With or without PrEP, these activities are happening. And there are in New York City, there's actually a quite active scene of people who are meeting in bathhouse like settings and engaging in this activity, but it's happening underground. It's happening in unlicensed locations without the proper safety measures happening. You don't even have like Department of Buildings inspections with proper egress, and they lack the public health interventions that a licensed facility would have. So a licensed facility with a public health framework would give HIV and AIDS advocates the opportunity to do outreach on site to make sure that testing, education, prevention is available on site. And that's why all the HIV and AIDS organizations, the nonprofits who work on defeating the epidemic, are in favor of this legislation, because they know that this will help us actually move forward in the fight against HIV and AIDS.
Well, I want to talk more about what those rules and regulations could look like, but first, let me reintroduce you for listeners just joining us. This is WCNY's The Capitol Press Room. I'm David Lombardo, and we're speaking with State Senator Erik Bottcher, a Manhattan Democrat who's introduced legislation designed to remove a restriction on reserving spaces for sexual activities at public baths or spas. And a note to listeners, we're continuing to discuss adult sexual behaviors, and this conversation may not be appropriate for all listeners. So as you alluded to, the legislation would empower public health experts to advise the state on the promulgation of new rules and regulations governing the license and operation of these types of commercial establishments, and set a few minimum standards and expectations. When it comes to those minimum standards and expectations, though, are you concerned at all about setting up a framework that you feel is too burdensome, that is too heavy-handed when it comes to promoting public health, like, as we talked about, the widespread use of PrEP or condoms or any other sort of safeguards? I mean, if they're saying you need to make sure you've been tested or you need to make sure you've had your dose of PrEP, is that a bridge too far, or does that make sense to you if that's ultimately what public health experts recommend?
I don't think that would be necessary. What our legislation
But what if public
does
health
is,
experts recommend it, though?
well, they aren't,
But we don't
and
know. I
that's
mean,
not
we
what.
don't know, though, because we don't know who the state is going to contract with and who they're going to consult with. And so maybe they will come back to people who say, yep, we think this makes sense, but you need to either A, go in with a condom, or B, make sure you've been inoculated or gotten some sort of dose of PrEP. I mean, if that is the case, does that make
Yeah.
sense to you?
I've never heard that. I've never seen that recommended anywhere. I don't know anyone who would recommend something like that. It's not something that was part of the Minneapolis regulations. The good news is that we have examples of regulations to look at, public health frameworks that govern the licensing and operation of these spaces. What our legislation does is it directs the State Department of Health to repeal the existing regulation within 180 days and then requires them within 180 days to promulgate new rules and regulations establishing a licensing framework. And they would work with leading public health experts. There's no public health experts that I've ever heard recommend something like that. Again, these facilities, they exist all over the world, all over the United States, and they haven't been a problem. In most instances, people don't even know that they're there. And by allowing these licensed, regulated facilities to operate under clear health and safety standards, the public health agencies, they would have the opportunity to provide the prevention resources, connect patrons to testing and treatment, conduct inspections, address legitimate health concerns. So the State Department of Health, they have licensing for every kind of business you can imagine. We would expect them to work with experts and establish a framework for this.
And what about those operations right now that are working in the shadows, so to speak, or underground? If they ultimately decide not to get licensed, they look to continue the status quo, how would you like to see the state respond to those types of operations if your bill does become law and there are regulated, licensed operations basically competing with them?
Well, we want to see rules enforced across the board when it comes to licensing by the Department of Health, and by allowing licensed facilities to exist, it would greatly reduce the number of underground unlicensed activities. And by the way, and that's not even talking about all the person-to-person activities that are happening out there. By providing these licensed facilities, it's a critical part of addressing the unsafe settings that exist out there.
So you feel like some of the current operations would likely transition under the law to become licensed?
Absolutely. Yeah, absolutely.
Well, unfortunately, that's all the time we have for this conversation. We've been speaking with State Senator Erik Bottcher. He is a Manhattan Democrat. Senator, thank you so much for making the time. I really appreciate it.
Thank you so much. Take care.
And for more Capitol Press Room coverage, including conversations with lawmakers and advocates, check out capitolpressroom.org or wherever you download your favorite podcasts. Thanks for listening to today's edition of the Capitol Press Room. For an insider take on what's happening in state government, check out our Dispatches from Planet Albany show, available wherever you get podcasts or at capitolpressroom.org.
Join us again for Capitol Press Room, a production of WCNY Connected, Syracuse.